Hey everybody, Dr. Ramos here. Today we're going to learn about the reproductive system, and we're going to divide this class in two videos. The first one, we're going to be talking about the male reproductive system, and after that we're going to conclude with the female reproductive system. So first we're going to focus on the microscopic anatomy. So we're going to learn from outside, external anatomy, to inside, internal anatomy. And because the reproductive system is all about the gametes or the reproductive cells, we're going to see that the location of the sperm, which is the male gamete, is in the testicles. When we start learning the internal anatomy, we're going to start from there. So we're going to start learning the testicles, and we're going to learn the parts of the reproductive system and the way how the sperm travels from the testes to outside through the male reproductive tubules, penis, and outside. After that, we're going to look at the cells in more detail. So all this part, which is the testosterone, the hormones, but spermatogenesis in the sperm, this is microscopic anatomy, and that's what we're going to do in the female reproductive system as well. We're going to start with the macroscopic, and then we're going to conclude the microscopic anatomy and hormones. Okay, the male reproductive system, the major function of this system is to produce a sperm. And when we said produce a sperm, we're talking about, uh, high quality sperm. So we will see that there are certain things that can affect the quality of the sperm and therefore the ability for the sperm to be able to reach the egg in the female and fertilize the egg. So there's certain conditions that in the anatomy we're going to learn are important to maintain this production of sperm. And in general, the male reproductive system is composed by organs, but also by glands. So the three major glands that we're going to talk about in this class are the bulbourethral glands or Cooper's glands, the prostate gland, and the seminal vesicles. I want you to keep in mind that one of the most important things, and that students most of the time forget, is to learn the location of these glands, how these glands relate to each other, what is above these glands, what is below, what is around them. So make sure that you keep in mind, or that your mindset is the location of these glands, okay? And what is the reason, what's the function of these glands are important to produce what we call semen. Also, we have a duct collection of ducts or a ducting system, which is composed by the ductus deferens or vas deferens. This is the longest one. This basically is just a tube that goes from the testicles all the way to the ejaculatory duct, which is a different duct that we're going to learn later. Epididymis and two testicles or testes. Important here is the testicles or the testis. That's the place where we have the sperm, okay? The sperm, once again, is the male gamete and is the most important cell because reproductive system is all about to transferring the genes or the DNA that those sperms contain to, to fertilize the egg and have offspring. Now, externally, the male reproductive system, this is a cartoon of representation. The male has the penis and the shaft. The head of the penis is called the glans penis. This is how that looks like in circumcised male. And on uncircumcised, what we have on top of the glans penis is skin that covers the glans penis. This skin is called the prepuce or foreskin. And the procedure, circumcision, is the procedure in which this foreskin is removed and the glans penis is exposed. Now, the glans penis also in the border contains the corona. Importantly also is the scrotum and the scrotum sac. So what is the scrotum? The scrotum is basically a sac of skin and muscle that it houses both testicles. So we're going to see and we're going to learn in detail now, the scrotum and the testicles. Once again, because there's where we have the sperm. So the way how we're going to learn anatomy is from the testicles, And keep in mind the pathway that the sperm will have to travel in order to be secreted outside of the body. So we're going to focus on the testicles now, and the scrotum, the next slide. So let's just start learning in more detail the scrotum. We mentioned already that the scrotum is just this sac of highly pigmented skin that houses the testicles. And important here, underneath the skin, when you remove the skin, we're going to find that we have a layer of muscle, okay? And this is going to be important because we know that the testes are located in the scrotum. Within the testes, we have the gamete, the male gamete, which is the sperm. And we said that the main goal of the reproductive system, the male reproductive system, is to produce healthy sperm. When I mean healthy sperm, is a sperm that is able to swim, that has a good anatomy. And keep in mind that in a male, a sperm is produced constantly. So, and the sperm has several phases in which there's going to be transformation from a very mature cell, which it doesn't have or it doesn't look like the mature sperm that we will learn. Um, and this process of transformation or spermatogenesis consist in that, in converting a very immature, unable cell to a cell that is unable to fertilize an egg into a cell that is mature, that has a specific anatomy, and has the ability to swim and penetrate the egg of the female or the gamete and be able to fertilize that. So there are many factors that affect the production and of this process of spermatogenesis. One of them, of course, is the temperature, as is written here. So the testes, in order for them to be healthy or have an ideal temperature for the sperm to grow and mature appropriately, has to be 2 to 4 degrees Celsius below the core body temperature. So what that means is that depending on the situation, right, we know, or you should know, that the testicles, they're not normally contained within the abdominal cavity, but instead they're kind of hanging out of the pelvis. So these muscles will contract or relax to with the goal, with the purpose of maintaining this ideal temperature. So when the conditions are cold, for example, if the temperature inside or the temperature of the testes go down because it's cold, these dartos and cremaster muscles will contract to increase the body temperature. Will contract, will pull the testicles up closer to the core body, and then that will improve, or that will keep the testicles temperature up. Now, and the opposite, if the temperature increases or it start getting too hot, these muscles will relax, allowing the testicles to descend, and the testicles will move away from the body core, promoting heat loss, right? Now, important here in this picture is that illustrate those muscles. We have here the dartos muscles and the cremaster muscles. It's very important for you to recognize that we have, or there's two cremaster muscles. Each cremaster muscle involves with the control of each testicle. While if you look at closely, dartos muscle is a single muscle that wraps that entire scrotum. So when the dartos muscle contracts, will improve or will move both testicles up. Cremaster muscles, when they contract, they will move the testicle that is involved or that they control. So two cremaster muscles, one single dartos muscle. Both of them, they have the same function, but it's important to know that little detail that there's only one cremaster dartos and two cremaster muscles. If you remove then these muscles, then we're gonna see other structures like the testis itself, right? Now this word with the I at the end is a singular. Testis with an E at the end, that is plural, right? Or a synonym for testis will be testicles or testicle, right? So just for you to know that. So what else? We have other structures that we're going to learn now, that right above the testis or the testicles, we have a structure called the epididymis, right? This little structure. And I told you before that your mindset should be when you learn the parts of the male reproductive system, and female is to orientate yourself in terms of location. So the structure that is on top of the testicles and more posterior, okay, is the epididymis. And just remember that the word epi means on top of, okay? So epididymis on top of the testicles. Um, After that, we have a tube that connects the epididymis. This tube is called the ductus deferens or vas deferens. And this tube is the one that runs all the way up to the penis, as we're going to learn later when we look at the details. Okay, so this is a very long tube. And with the ductus deferens, we also have important structures like arteries, veins, lymphatics, nerves. All these together is what we call the spermatic cord. So this is something that students sometimes confuse. What's the difference between the ductus or vas deferens and the spermatic cord? The spermatic cord is a structure that contains the arteries, the nerves, the lymphatic vessels, the veins, plus the vas deferens. The vas deferens is this tube that connects the epididymis with the prostate gland, basically. So we're going to learn in just in a second that the vas deferens empties its content into the ejaculatory duct, which is a duct that runs inside of the prostate gland. Let's look at the testicle in more detail. So when we remove that layer of muscle that wraps each testicle, so this muscle is represented here by all these pink kind of pink area, right? This is what represents the cremaster muscle. Okay, so the cremaster muscle, if we remove the cremaster muscle, what we're going to see is a connective tissue is the first layer beneath that cremaster muscle called the tunica vaginalis. So the testicles, they have two tunicas. The outermost is the tunica vaginalis. And as we can see, will wrap not just the testicle itself, but two other structures. So let me just draw this really quick. So what we, call a testicle or testis for singular, is basically a seminiferal tubules. It's a collection of seminiferal tubules. Seminiferal tubules are all these structures that we can see here. It's a tubular structures, look like worms, right? Basically, it's a very complex neck network of tubes that contains the sperm and other cells. So within the seminiferal tubules, we have three important cells. We have the germ cells, which is also the sperm, right? It's the male gametes. We have the Sertolin cells, which are cells that support the sperms. And we have Leydig cells, which are cells that produce hormones, also important in the development and maturation of the sperms. Now, all of them are within the seminiferous tubules. Now, all these seminiferous tubules, they're wrapped by a second tunica called the tunica albuginea. So tunica albuginea is specifically for the seminiferous tubule. So you can see that tunica vaginalis is bigger, right? Because it wraps more than just the testicle itself. It wraps also this structure. I'm going to change the color here to show you. This is C-shaped structure that is on top of the testicles and more posterior, is called the epididymis. So the epididymis is contained within the tunica vaginalis, and also the epididymis connect with a singular tubule or tube or duct, which is called the vas deferens. So the vas deferens or the ductus deferens is this tube that connects the epididymis and is very long, exit the scrotum, exit through the spermatic cord, and ascend all the way through the pubic bone, and then eventually connects to the ejaculatory duct, which is a duct that is within the prostate gland. So basically, In simple words, you can think about this vas deferens as a tube that starts in the scrotum, the testicle, with the epididymis, and connects all the way to the prostate gland. Okay, another concept that is important to recognize is that during embryologic development, the testicles, they initially they're located in the abdomen. That's where the gonads or the male gonads are located initially. But part of the process of um, development involves the descending of these testicles from the abdominal cavity into the scrotum. Okay, so that's what normally should occur, and this happens through in a structure, a tubular structure called the inguinal ring. So the inguinal ring is a tube that allows the testicles to descend into the scrotum. Now, as part of uh, the normal process, right? Now, the clinical relevance of this is that un, undescended testicles can be problematic in a baby. So part of the screening in a newborn, right after the baby is born, uh, in you will see that in practice, there are many things that we look at, right? There are many medications and things that the baby will get as a newborn. Just to give an example, vitamin K, hepatitis B vaccine, sometimes, not sometimes, but most of the time, um, an ointment, an antibiotic like erythromycin in the eyes to prevent pink eyes, infection of the eyes. And part of the physical exam consists in look at the scrotum and see if both testicles are descended. Okay, if they're not, either if one of them is not in the scrotal sac or in the inguinal canal, or both, maybe both are not descending, the medical term for that is called cryptokidism or cryptokidism. So cryptokidism is the clinical term used when one or both of the testes fail to descend into the scrotum, and this is not necessarily just, I mean, prior to birth, of course, because that's when we realize sometimes, or if it isn't during the ultrasound, that you might not, during the ultrasound, you might see that the testicle is not in the scrotum. Okay, now this condition, as you can imagine, what we just learned before about temperature, if you have a baby with a testicle that is trapped in the abdominal cavity, the testicle there will be will have always the body temperature. Okay, so the temperature, in order for that testicle to produce a sperm, will definitely affect the ability to produce healthy sperm, right? If it's both, which is worse. So cases of infertility will the risk of infertility will increase the more uh, time the testicles remain in the abdominal cavity. So infertility is one of the consequences or side effect of undescended testicle. Now, the other one, and the most important one, I will say, is that a testicle that stays in the abdominal cavity has way higher risk, okay, risk to develop or to become cancer. So there's a high risk of testicular cancer, and that is the reason why this, if a baby has cryptokidism, they have to fix it. Okay, we usually wait around 6 months to let, because many times the testicles will descend eventually or spontaneously. But if after 6 months the testicles are not descended yet, that means that they less likely will do it. So the baby will need to have a surgery to fix that, to bring the testicles down, and ideally you want to have that done as soon as 6 months, and don't wait more than a year. Okay, because once again, the risk of testicular cancer and also long-term infertility. All right, so we can move on. We talk about the seminiferous tubules. We said that this one contains the sperm, very immature, I would say, sperms. And I'm pointing this out because during the process of maturation, spermatogenesis, some of these immature cells will be transferred by peristalsis from the seminiferous tubules into the epididymis. So that, and you can see here that at this point, the sperm is not able to move by itself. So it has to be moved by peristalsis. The cells are not able to swim. So it's in the epididymis, okay, which is this very long tubular structure, right? It's basically a highly packed. If you unwrap the epididymis, what you're gonna have is a very long tube, okay? But so it's a coiled tube attached to the testis, and that is the place where the cells mature fully, or fully mature, I should say. So what that means is that it's in the epididymis where this immature sperm will transform and will mature and will acquire the ability to move. Okay, so one of these transformations, as we're going to see later, is the formation of a tail, a body, and this tail is, or flagellum, is the one that will empower the movement of the sperm. So the epididymis is a very important structure because that is the place where spermiogenesis, okay? It's different than spermatogenesis. Spermiogenesis is the process in which these immature, immobile uh, cells will be able to gain a tail, a flagellum, and will be able to mobilize themselves, will be able to swim and move away from, or just swim, I should say. We have already mentioned the vas deferens already, but it's good to visualize how long this tube is. So notice in this picture that we have a testis here. We have the epididymis on top and posterior to the testis. And the very end of the epididymis, the tail, is the part that connects with the beginning of the vas deferens. I'm saying the beginning because remember that we're following the pathway how the sperm will travel from the testicles and will eventually exit through the penis. So we're looking at now the longest two, and of course we have two because one for each testicle. In this case, we're looking at the right testicle. So the vas deferens will start here in the epididymis. Notice that it will ascend and will exit the scrotum through the spermatic cord, will reach the pubic bone, which is this bone that we have over here in front, and then the vas deferens will pass above the bladder. This is the representation of the urinary bladder, and it will go posterior. Then the vas deferens will dilate at the very end. We're going to learn that in this part of the vas deferens, which is more dilated, is called the ampulla of the vas deferens, and that is eventually will merge with a gland. Okay, this gland is called the seminal vesicle, and there are two seminal vesicles in the same way how there are two vas deferens. So both seminal vesicle and the ampulla of the vas deferens will form a duct called the ejaculatory duct, which is the one that penetrates the prostate gland. In this cartoon, this area here, this gland that looks kind of circular, that is the prostate gland. Of course, what you're seeing here is half of the prostate gland to show you that the prostate gland has two tubes that pass through the prostate gland. So this one is the ejaculatory duct, which we're going to see it in just in a minute, but know it and see how long is the vas deferens. Also important in as a procedure of birth control in a male, this procedure called vasectomy. Okay, we just learned that that tube is called the vas deferens. Vasectomy is the procedure in which this vas deferens is cut and sealed. Okay, and therefore it prevents that the sperm reaches the other portions of the vas deferens. There's going to be one of the questions sometimes you might be thinking is a male with a vasectomy be able to ejaculate, will produce semen? Yes and no. So during intercourse, the male will be able to produce and ejaculate, okay, uh, the contents of the glands, seminal vesicles, the contents of the prostate gland, the contents of the bulbourethral glands, but this will lack of sperm. So basically, we'll have the fluid, but with no sperm, okay. And for the purpose of your classes, just make sure that you know that this surgical procedure in which both vas deferens are cut is called vasectomy. Now we talk about semen in some degree while I was explaining vasectomy. Also, so semen is this fluid that contains sperm, but other things. Now, there are going to be three important glands that you need to know for your exams, and they're important just to know about those glands for the reproductive system. Um, let's start with the first ones, the more superior ones, the seminal vesicles. Without looking at this picture that I have here, what you need to think, so you never get this wrong, or that you always are able to identify the seminal vesicles very easy, are two little glands that are located behind the bladder, okay, the urinary bladder. So notice that this is the interior with the penis here, and this is posterior. So the bladder is this in kind of orange, right? So the seminal vesicles, they're behind the bladder. So an easy way to identify seminal vesicles is by looking for the bladder, and right behind the bladder, that's where they are. So there are two, and they produce about 60% of the volume, okay, of the semen volume. What is the substance that they produce? It's a substance that contains a lot of sugar, okay? This sugar is called fructose, and this fructose is the sugar that the sperm is going to utilize or is going to use to as a fuel, as a source of energy by the mitochondria to generate ATP. So what that means is that the sperm, I'm kind of moving ahead, the general shape of a sperm will look like this, okay? So the sperm has a head, a body, and has the flagellum, which is a tail. Now, in the body of the cell, you have a bunch of mitochondria, and the mitochondria is like a little engine that produces energy, produce ATP. But in order for the mitochondria to produce ATP, you need the fuel. So the fuel is going to be this sugar. So the sugar will be breaking down, and that's the chemical that the mitochondria inside the sperm is going to use to empower the movement of the tail that will allows the sperm to swim. Remember that the sperm will have to, once it's ejaculated, will have to swim through the female reproductive system until it reaches the egg and the fallopian tube. Second important gland that we're going to talk about next is the prostate gland. One of the first things that you need to know is the location, okay? And make sure that you know what is around or close to the prostate gland because it's important. So if you look at this picture, the prostate gland is this gland that we have over here. Notice that above or superior to the prostate gland, what we have is the bladder, okay? And notice also that the seminal vesicles that we just discussed also are superior to the prostate gland. What is inferior to the prostate gland? There's another little gland called the Cooper's gland that we're going to talk about that in just in a minute. And also notice that the prostate gland is a gland that is penetrated by two tubular structures. The one that is related with the bladder is the urethra, which as you can see here, in a male, the urethra is very long. And that's why in a male, the urethra has three portions. In a female, the urethra is shorter and it's just called urethra. But in a male, the urethra has three portions, and the portions of the urethra has to do with the structures through which the urethra is passing. So, for instance, this specific part of the urethra that passes through the prostate gland is called the prostate urethra or prostatic urethra, as we can see here in this picture. It will be all this one. The prostatic urethra is a tube that allows urine from the bladder to exit, right, through the penis and to exit the body. But also the urethra is shared in terms of ejaculation material. So when the semen is ejaculated, the semen also will use the urethra to exit the penis. This is important when we look at the third gland, because the third gland will, the fluid that will be secreted will help or will be related to that. So one thing, once again, was the prostate, the location. Um, Notice also this duct, the ejaculatory duct. This ejaculatory duct is the tubular structure through which the content of the seminal vesicle plus the sperm that comes from the vas deferens, they mixed here and pass through the prostate gland. The prostate gland produces substances, produces an alkaline fluid, and it's kind of milky in appearance, so it looks kind of white, and that's what gives the color of the semen, this milky appearance. This alkaline substance produced by the prostate gland is important because the sperm is very sensitive to acid or to acidity. And if we think about as in general the process of reproduction, the sperm will be uh, secreted into the female reproductive system, the vagina, for example, and the vagina is very acid. So the importance of the prostate gland secreting this alkaline substance in the semen is because this alkaline substance will neutralize the acidity of the vaginal pH, and that would allow the pH overall to become less acid, and the sperm will have the ability to swim and to move, to be able to move through the female reproductive system. That's the main importance of that prostate gland. Now, the prostate gland, in some situations, in certain situations, can cause problems, especially when the gland start becoming enlarged or become bigger. This condition is called benign prostatic hyperplasia. It's a condition in which is seen in males which are older, like let's say depending on the age, but 50s, 60s, 70s. And the problem is that the gland can enlarge in this way, right? That's going to be not a big issue. But the problem is that if the gland enlarges this way, so inward, can cause compression, okay, of the urethra and partial obstruction of the urethra, which will explain the symptoms of someone with prostatic urethra, which is uh, patients or males with BPH or benign prostatic hyperplasia that has partial obstruction. They will have problems urinating. So they will have urine flow that will be decreased. We also see in the patients complaints about bladder empty, incomplete bladder empty sensation, like they feel like they go to the bathroom, they try to urinate, they have to push harder, and they don't feel like the bladder is completely empty, and they have to go back several times, right, to urinate. So all these symptoms are related to this partial obstruction. If it's severe, it can be even so severe that can cause an acute obstruction, and the patient will have a lot of abdominal pain, a distended bladder that needs to be catheterized through the penis to open this area and release the bladder from all the urine. Okay. Now another condition is cancer, right? So prostate cancer is the second most common cancer in males, and prostate cancer is important because sometimes can cause mortality, right? If the cancer is um, has metastasized or has spread to other organs. The digital exam, if we look at this picture, the anus is located here, the rectum is here. So the rectal exam that some males might have is the procedure in which the physician will introduce their fingers to palpate the prostate gland through the rectum. And the palpation of the prostate gland basically will determine if the gland is soft or the gland is hard, that is enlarged, the consistency, or if there's nodules or masses that that the physician will maybe be able to palpate and feel, and that will lead to do further diagnosis. Also, there's a common test called PSA, which is a test that is done to screen or to diagnose or support diagnosis of prostate cancer. Normally, the PSA should be less than 4. So when the PSA is greater than 4, that's something that usually is abnormal, right? PSA usually is something that is used also in a patient with cancer that helps to determine if the cancer has responded to the treatment, and by keep looking at the numbers of the PSH. So it's also for to see progression and see response to treatment. The last gland is the bulbourethral gland, also known as a Copper's glands. So there are two Copper's glands. There are two seminal vesicles. There's just one prostate gland. Notice that the Copper's glands are right below the prostate. Okay, so in order from superior to inferior, we have the seminal vesicles are the most superior ones. Then the prostate gland is below, and below the prostate gland we have the two little Copper's glands or bulbourethral glands. We mentioned briefly that this specific part of the urethra was called the prostatic urethra because it's passing through the prostate gland. Now, all this area that I'm circulating here is what we call the penis, right? So there's a portion of the urethra that passes through all this area of the penis. That's called the spongy urethra. But notice that there is a little portion of the urethra which is very short, that is called the membranous urethra. So, membranous urethra. Okay, in terms of going back to the bulbourethral glands, those are glands that during intercourse or when the male becomes sexually aroused, these glands are going to produce a fluid that helps to lubricate all these spongy urethra. Also, it helps to neutralize some of the acidity that might be in the urethra due to the urine. Remember, the urine has an acid pH, so it's acidic. So these bulbourethral glands produce the fluid called pre-ejaculatory fluid, which once again, the main function of this pre-ejaculatory fluid is to lubricate the urethra to allow the semen to pass very quickly without less resistance through the urethra during the ejaculation process. Now, to conclude this part of the microscopic anatomy of the male reproductive system, let's review the penis. So the penis is the male organ of copulation or sexual intercourse. The penis is composed by 3 major tubular structures. And when I say tubular structures, you can visualize this better here. This is a transverse cross-section of the penis shaft. So it has these 3 structures, okay? So the 2 in the top, they're called the corpora cavernosa when you talk about them together, or corpus cavernosum if it's a singular, right? So it has 2 corpora cavernosum, and in the base or in the bottom, inferior to that, we have the corpus spongiosum. And as you can imagine, when we think about the urethra is the structure that passes through that corpus spongiosum. That specific portion of the urethra is called the spongy urethra. And now you know why it's called spongy urethra. In this lateral view, we can see how long is the corpus spongiosum. And if you can see that appearance of the corpus spongiosum looks like a sponge, right? So all this area is the corpus spongiosum, and you can see here the spongy urethra passing through that area. Now, importance here also is that the way how the penis, how erection works, which is what we're going to cover now, is based on blood accumulation, okay? Blood accumulation, and those 3 structures is the one that is responsible for the erection of the male. So we're going to see that now. So what we call the penile erection, okay, is the result of vasocongestion, so meaning that there's not enough blood flow And everything starts with the release of a chemical called nitric oxide. So nitric oxide is a chemical that is a vasodilator. So this is important. It vasodilates the arteries, okay, that provide blood supply to the penis, to the corpus spongiosum and cavernosum. The blood start filling all the little chambers in the corpus spongiosum and cavernosum, and these structures start compressing the veins, which is the drain of blood, okay, of the penis. So when the nitric oxide is released, there's a vasodilation, more blood start accumulating in those areas, causing increase in the size of the penis, and at the same time there's a partial obstruction of blood that allows the blood to not escape that easily through the veins. So that at the end is what causes the penile erection. Okay, now let's talk about the cells, okay, microscopic anatomy, and we're gonna learn about the hormones involved here in the male reproductive system, and then the cells itself, specifically the sperm. We mentioned earlier that the most important part of the reproductive system will be the testicles, right, or the testes, because within the testes we have those seminal tubules, or seminiferous, should I say seminiferous tubules, which are again just little tubules that contain the cells that are important here for reproduction. So when you look at one single tubule, this is a real image of one of those tubules in a transverse cross section. This, what I'm circulating here, is the lumen. In other words, is the hole through which the sperm is going to flow, and this will be the wall of the seminiferous tubules. Notice here that we have the cells called Sertolin cells. Sertolin cells are cells that support. So they're supporting cells. They promote sperm production and also control if the germ cell will live or die. Sertolin cells. Within the Sertolin cells, right beside them, we have the spermatogonia. The spermatogonia is the most immature form of a sperm. Okay, so the sperm. And they're very close to each other, as you can see, Sertolin and spermatogonian. These germ cells are very immature. They are going to, eventually, they're going to suffer two cellular divisions called meiosis, and in some point these cells are going to will travel through the lumen of the seminiferous tubules, and eventually they will, from the lumen, they will eventually travel to the epididymis to complete their maturation. This process in which the immature sperm become mature is called spermatogenesis, which is what we're going to cover in just in a minute. The last and the third cell is the Leydig cells. These Leydig cells, or interstitial cells, are cells that are located between tubules. So if this is another tubule here, and I have another tubule here, and I have another tubule somewhere there, notice that the Leydig cells are between those tubules. Those are the cells that are important because they produce the hormone testosterone. And as you can remember from previous classes, testosterone is the main male hormone, is the one that is responsible for the secondary male characteristics, which we know that the increase in testosterone in puberty is what is responsible for all the changes that will occur in a male during puberty, including the beginning of the spermatogenesis. So how this production is regulated, or how spermatogenesis is initiated. We said that it starts during puberty when the testosterone levels start rising or increasing. Remember that everything starts in the hypothalamus. The hypothalamus is the area in the brain that releases these gonadotropin releasing hormones. The hypothalamus releases these hormones, which then stimulates the pituitary gland. The pituitary gland then releases the two hormones, LH, luteinizing hormone, and FSH. So here's the part that you need to remember from in the past. LH and FSH are hormones produced by the pituitary gland that affect both female and males. So the gonads. In a male, especially LH, is the main hormone that will stimulate the Leydig cells to produce and release testosterone. Okay, FSH stimulates the Sertolin cells also, and the process of spermatogenesis starts with FSH. So testosterone, the functions of testosterone are the ones that we just can see here. One of them is testosterone is vital for the spermatogenesis process. Remember, in simple words, spermatogenesis is the process in which immature sperm will become mature. And the second function of testosterone, as we discussed a few minutes ago, is the male secondary sex, is the hormone responsible for the male secondary sex characteristics. Like all of these are those that you can read about it. Also, clinically relevant in females, testosterone play a role in maintaining libido or sex drive in both males or females. So when males or females, in the case of a male, if the gonads are not producing enough testosterone, you might have symptoms in a male like irritability, lack of energy, unable to produce healthy sperms, and therefore infertility. In a female, sometimes you might see patients getting shots, okay, of testosterone. Sometimes that is because increases sex drive, and sometimes it's used for patients in this case. How you get testosterone? There are several ways to administer testosterone. There are testosterone shots, there are pellets, there are cream. So there are various, but that goes beyond the scope of what you need to know for your exams. Just know the main functions of testosterone, which ones are the cells that produce testosterone, and where testosterone is produced, primarily in the testicles. Now let's talk about spermatogenesis in more detail. This can be very complex to understand, but if you have the general idea and the good basis of what is going to happen, it should be easy. At the end, what you need to know is that everything that we learn here is about the DNA material and the chromosomes that are contained within the DNA that is contained within the chromosomes. Okay, so we start with a single, and I have two in this picture. This is for the male, the sex germ or the germ cell, and this is the female. I have both here to compare. Okay, so all the cells are called somatic cells, are cells that compose all the tissues and organs in our body. Okay, so all the somatic cells that we have has in total, they have in total 46 chromosomes total, which is the same to say 23 pairs. Now, there's another cells called germ cells. The germ cells are the gametes, okay? So male and female, that's the sperm. So as we can learn here, during the process of spermatogenesis, starts with a very immature spermatogonium or spermatogonia, and will end in the formation of 4 cells that will contain 23 chromosomes in total. So important here, the word total, okay? It's not the same 23 pairs versus 23 chromosomes in total. So basically this process of division in which the chromosomes will be there's going to be a distribution of the chromosomes through these ones is what we call spermatogenesis. Important also that all the somatic cells, the way how they divide and how they pass the DNA is through mitosis. Remember from AMP1 Mitosis is this process in which the entire DNA is copied, and what is going to happen is that the cell during mitosis eventually um, will have 92 chromosomes in total. So just think about 46 chromosomes will be copied, right? And then that leads you to have 46 plus 46, 12, and that will be 92 in total, right? So, and eventually those 92, once the cell by mitosis divide, then 46 will go to one cell and the other 46 will go to the other cell. That's mitosis. Now, here in the spermatogonia is, or in the germ cell is slightly different. This process is not called meiosis. Meiosis occurs a little bit, right, when we have the primary spermatocytes, but it's less relevant. What is relevant here is to know that the germ cells, they will divide by meiosis. So meiosis is very specific for the germ cell. It's basically the same than mitosis is division of chromosomes and then distribution of those chromosomes within the new cells. So there are two meiosis, meiosis 1 and meiosis 2. In meiosis 1, as you can imagine, what we're going to have as a result is two cells, and each cell will have, or cells that are called haploid cells, because they will have only 23 chromosomes in total. So here we have 46, and then half of those chromosomes goes to each of the cells. So then here we have 23, and here we have 23. That's meiosis 1. Then there's a second division that occurs, and that will lead to the production of other two cells, which are called spermatids. And each individual cell will still have 23 pairs of chromosomes in total. So in a nutshell, what you need to know is that the end of the process of spermatogenesis the result of that is the production of 4 spermatozoids, okay? 4 of them, and each individual spermatozoid will have 23 chromosomes in total. And we're going to learn also that within those chromosomes, we have what we call the sex chromosomes, X for female and Y for male. So if therefore 2 of them will have X sex chromosomes and the other 2 will have Y chromosomes, okay? All right. With the female, it's slightly different. I'm going to just go ahead and cover that really quick here. There's still going to be 2 meiosis, right? 2 meiosis. But in the female it was going to be a little bit complex, okay? The phases and how these occur, I'm going to explain that in detail when we learn the female reproductive system. But just know that at this point that in a female, we start with a very immature cell, germ cell, and then at the end, instead of having 4 mature cells, we only have 1, okay? So only in the male, we know that we have 4. In a female, we have 1. And we have then 3 polar bodies at the end, okay? At the end, we're going to have 3 polar bodies that they're not represented here. Again, we're going to see these polar bodies in more detail when we look at the female reproductive system. This picture just illustrates what are the chromosomes in a somatic or regular body cell versus the chromosomes in the germ cells or gametes. So first notice that what we have here is 23 pairs of chromosomes, and the last pair of chromosomes is the chromosome X and Y. So by looking at this map of the chromosomes, X and Y represents male, XX represents female. So we know based on these chromosomes, we know that this belongs to a body cell that is from a female, okay? Now compare that against the gametes. For example, it could be an egg cell, or if it is a sperm cell, will have in total 23. Females, that last chromosome, the number 3, is always X. Okay, so in a female, the X cell, okay, always will have the chromosome number 3 will always be an X chromosome. In a male, it could be an X or it could be a Y, as we learned before. But you can see here the difference. Here we have 23, but they're not in pairs. Here we have 23, but they're in pairs, so that means 46 in total. And this just to illustrate once again what we just covered, right? The phases of meiosis, meiosis 1, meiosis 2. This is happening in a male. This is happening in a female. What I want you to take from this illustration is that in a male, a single immature spermatogonium will lead to the formation of 4, okay, 4 spermatid cells. Each of them that has 43 chromosomes in total, and then the 23 chromosome, the very last one, 2 of them are going to be X, and 2 of them are going to be Y chromosomes, okay? Then we have what we're going to cover next, a process that is called spermiogenesis. And notice that spermatogenesis sounds very similar to spermiogenesis, but it's different, right? So spermiogenesis is the process in which these spermatids will have or will suffer a series of transformations that will lead to the formation of the mature or the normal appearance of the cell, which means a cell that has this long tail, has a body, and it has a very specific head. That process of coming from here to here is what we call spermiogenesis, and that takes place in the epididymis. Okay, so we cover that, or we mentioned this earlier. Epididymis is important because here's where spermiogenesis will take place, and only the cells that have this anatomy are the cells that are going to be able to swim by themselves. Okay, so these cells that we can see here, these are cells that are still in the seminiferous tubules. They cannot swim. They have to be transferred to the epididymis by peristalsis, while the cells that we have here are the mature cells. They can swim, they can move by themselves. If we look at the female, okay, we start with a very one single immature cell, which will be divided by meiosis in the same way how the male. But notice that at the end of this, what we have is what I mentioned before. We have at the end one single ovum or egg cell plus 3 polar bodies. Okay, so and this ovum will have, of course, 23 chromosomes in total, and the last chromosome, the number 23, will be always an X chromosome for the female. When the male and when the sperm and the ovum fertilize, when they become one, then we're gonna see what sex will be from there. So if it's one of these X chromosomes from the sperm, the one that fertilized the egg, we're going to have XX, which means the baby is going to be a female. If it's instead one of these 2 sperms, the one that fertilized the egg, what we're going to have is an X, which comes from the mother, and the Y, which is the one that comes from the father. This is going to be male. Okay. Let's finish this class talking about the spermiogenesis, which we already mentioned it, is the transformation of the true sperm. Spermiogenesis, we mentioned that this takes place within the epididymis. And basically, in simple words, what happens is the transformation of a cell that is unable to swim into a cell that will look like this. So, excuse me. So, a very important part here is to distinguish the parts of the sperm. The sperm has a head, midpiece or body, and a tail. The tail is also, especially this part, is also the one that we call flagellum. Okay, flagellum is the tail, is the part that is going to move. Notice that here in the midpiece is where we have all the mitochondria, and this mitochondria is like a little engine. That's the one that will produce the ATP that will empower the movement of this flagellum. Another important structure and the head of the sperm is the acrosome. Okay, the acrosome is um, this area that contains a lot of enzymes that are important during penetration, during fertilization. When the ovum is released, the ovum has a bunch of cells around them that is like a wall. Okay, so the acrosome of the sperm contains enzymes that will break down these cells and will help with the penetration process. So then the sperm can penetrate the egg, release the DNA, and then form a cell, the one that we call zygote, and release the DNA and combine the chromosomes from the sperm with the chromosome of the egg. And that concludes our class in the male reproductive system.